As a medical doctor, how to? Empowering the lives of people with disabilities as a medical doctor involves a multifaceted approach that focuses on education, advocacy, and inclusive practices. Here are key strategies to enhance empowerment for individuals with disabilities. Step-by-step approach to empower lives for people with disabilities. 1. Educate yourself and others. Understand disabilities. Gain comprehensive knowledge about various disabilities, including physical, mental, and sensory impairments. Participate in training. Engage in workshops and training modules focused on disability awareness and inclusion in healthcare settings. 2. Promote inclusive medical education. Integrate disability into curriculum. Advocate for the inclusion of disability-focused modules in medical education to improve understanding and attitudes toward people with disabilities, PWD. Encourage clinical exposure. Support clinical placements that allow medical students to interact with people with disabilities, enhancing their practical understanding and empathy. 3. Implement universal design principles. Accessibility in practice. Ensure that your medical practice is physically accessible and that communication methods are adaptable to meet the needs of all patients. Use clear communication, employ visual aids and straightforward language to explain medical concepts effectively to patients with disabilities. 4. Advocate for reasonable accommodations. Support policy changes. Advocate for policies that ensure reasonable adjustments are made in healthcare settings to accommodate individuals with disabilities. Address barriers. Work to identify and eliminate physical, communication, and attitudinal barriers that hinder full participation in society for PWD. 5. Foster a supportive environment. Create an inclusive atmosphere. Encourage a culture of acceptance and support within your practice, ensuring that all staff are trained in disability awareness and sensitivity. Listen to patients. Actively engage with patients about their needs and preferences, ensuring they feel heard and valued. 6. Empower through advocacy. Be a voice for change. Advocate for the rights of people with disabilities within the healthcare system and the broader community. Collaborate with organizations. Partner with organizations focused on disability rights to promote awareness and access to services. 7. Encourage self-advocacy. Empower patients. Educate patients about their rights and available resources, encouraging them to advocate for themselves within the healthcare system. Provide resources. Offer information on support groups, legal rights, and community resources that can assist individuals with disabilities. 8. Continuously evaluate practices. Seek feedback. Regularly solicit feedback from patients with disabilities regarding their experiences in your practice. Adapt based on input. Use this feedback to make necessary adjustments to improve accessibility and patient care.